Welcome to the Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Hi, everybody, and welcome again to the Hanley Effect. I'm John Dyben.
I am Rachel Docekal.
Dr.
Hey, Dr. D, how are you?
I'm great. We're dibbing and disco.
We are dibbing and discoing today.
We cannot forget dibbing and disco.
No,
I mean, it's a beautiful, fun thing.
It was, and we left it for a little bit. It's back.
It's back.
It's back.
Well, we have a special guest with us today that I've, actually gotten to know over many years, little by little, just in working with different cases and patients. And I'm excited to have her talk about her history and her work. Dr. D, do you want to introduce our guest today?
Well, I think
or
you
do
can,
I get
but
to?
I want to say she is one of the most esteemed professionals, and she actually lives in my community out west by me.
You're going to make me cry. Thank you.
I am so grateful you're here. So do the honors.
So we have Pam Feinberg. Thank you so much, Pam, for coming in and spending some time with us.
It's an honor to be here. And I love both of you and the organization, and especially now what's going on with you guys.
Thank you.
Thank you.
It's wonderful.
And I feel the same way. And so, I've been with the organization for over 20 years. And in that time, your organization that I want you to talk about a little bit, it has, helped so many people. The work that I do is this moment when people are in residential treatment or even an outpatient, but people who, especially if you're struggling with addiction and other physical health and mental health conditions, they don't go away after treatment. And so there's this whole continuum of people need support throughout the life's continuum. Right. And you have developed amazing systems to make that happen.
Yeah. Well, I'm really proud that we've been able to do this. And with my nursing background is John, you pointed out, many years of being a nurse. Really starting and founding Feinberg Consulting nearly 30 years ago. It was next year will be 30 years. And the trajectory of what started, which was really catastrophic injuries, which really we were working with all ages, from a baby on up to an older adult that may have been in a car accident. And then and all of what comes with that and with their psychosocial history. I mean, the baby that I worked with was 6 months old and thrown from a vehicle. And it was, the family system was such that he wasn't strapped in, and it was a child protective services situation, and he had brain injury and really took him all the way through the foster care system and into a family adopting him. Wow. And still our company is following him in his teens and his early adult. I can't recall exactly what. I think he's probably 19 now, which is pretty incredible. And then an older adult that may have been in an accident. So with that history and what we've been able to do in creating the systems of case management and coordination of care, looking at all the systems, the psychosocial, the physical, the medical, the physical injuries, any drug addiction or alcoholism, because a lot of that, as you well know, comes with car accidents. And then as we got older adults, people started referring privately, because we were paid by the insurance company in Michigan for those people and still are. But as an older adult, we started getting those people with medical issues. And again, you're looking at, where the medical issues come from, and some of that was alcoholism and long-term alcoholism. And in 2010, my first client came to Hanley in the older adult program there. So that started the work that I've been involved in, and we still manage one of the clients that had a car accident came to treatment with you and was referred to us for long-term management. So, and he's been going on trips every year with a companion of ours and going to some amazing places out west, Alaska, and being able to still having a full life despite the injuries sustained in the auto accident and his dementia as a result of that.
So I just want to ask.
Go ahead.
Okay. So you're really one of the pioneers in case management as it relates to behavioral health, substance use, and mental health. And, our field is decades old. It's not, something that has a longer history than that. There's been a lot of change, but I want you to talk to us about really why that case management piece is so critical. Why, when somebody comes and has residential treatment, for example, why it isn't that you step out of treatment and you go on your merry way.
Right. So with everyone, including very intelligent people. So it doesn't have to be the intelligence or the money or any of that is not a protective mechanism. Sure. Like anyone who's coming out of treatment needs guidance and needs support. And it's a whole brand new life they're really starting in order to stay sober. That's right. And that includes not only recovery meetings, which would maybe NA or AA or whatever those meetings may be, but going to a psychiatrist or a family physician, internist, or whatever may come up, and following them, because all of a sudden if something happens and they go to their internist and the internist says, well, then I'll prescribe this for you. We are there to say gently, this is the history, and can you do this instead of this? So that's protecting that person, working with the family too, because the family system, as you do in your programs, you have family programs for family,
right.
And working with families coming out because they're lost and they think that they got it because. And I'm here to say I came through your family program in 2012. And
I love that. I love that.
And by that, when coming out of it, you think you know it all, but you don't know it all, even if you're a professional, because you can't be objective. Yeah. And there's so many things that come thrown in the history of life that came before, that predated those events of going into treatment and being able to recognize, oh, there's a problem here and let's handle the problem instead of pointing the finger at the person, so we work with the family and what are some of the patterns of life that you've had and what are the not genetic, but generational things that have happened in your family that brought how you know what to do, but maybe not knowing something else that could be helpful.
So, it's interesting. My daughter, Steve, my husband, Steve, and I say that we have a roommate this year. So my older daughter, she is on a gap year between undergrad and law school. And so this year has been spent taking the LSAT and applying to law school. And now we're through a lot of it. Now we're starting to get those acceptances. And I think for our listeners, I want to talk about case management as any one of those situations that you've gone through. And once you're through it, you think, oh, golly, if I knew at the beginning what I know now, I would have done this and this and this and this. And that's really the type of help and support that you and your organization provide. You know the best of the best. You can help people take those steps. And it is so helpful to have an advisor in school to help you navigate which classes to take. My daughter found some resources that helped her to know how to study for the LSAT and what to do in her application. had we not had those resources, we would have floundered
Sure.
even more than you do just
Right.
going through the process.
So that's what I say we are, as case management. We are a resource, a guide, an advocate, an advisor to really a
roadmap.
coach and all of those things. To be able to be with side by side with the person and the family so that these situations arise. And many times, young adults are not through school yet because of their substance use disorder. And so by guiding them and finding ways to help them through that process, and also, rehab, voc rehab, where could they be best suited to go into a different type of work that's not necessarily going to trigger them in where they've been. We have worked with a rabbi in order to help him find a different vocation because being in his vocation wasn't going to work any longer given the circumstances. And there's another religious person that we're working with currently as well because they don't want to go back to the same environment. And so finding all of it is really post treatment is continuation of what their life is going to be or could be. And without that guidance, they're like, I don't know what to do. I don't know how to get my prescriptions without going in and getting freaked out. Yeah. Just the littlest things that people just don't know.
You're cartographers. You're map makers. I think about that. I think about a map maker is someone who's got a set of skills. They know how to make a map, but they go into new places with people because everybody's circumstances are different. And you go in, you don't necessarily have their map until you get to know them, but you bring these skills of, hey, we know how to make a map for you.
I love that terminology. Because it really does, the map, and then we're their guide on that map.
Yeah.
And they may take another course, and we can get them back on course.
Right.
Because, there are many ways that we all can go. And there's struggles that occur throughout all of our lives. And if it's this way, it could veer left a little bit.
Right.
Instead of veering left and going all the way out to the sea and drowning, or wherever you are, maybe right here. Sure. But then we can bring them back on so that they're not only struggling and surviving, but they're really flourishing.
I love that.
Pam, during your time, have you seen perceptions about behavioral health stigma change?
I have, and there's still a lot of questions.
Okay. So
interesting. I don't know if you're familiar with the memoir Mama. There's a memoir written by a woman who was in a very established community, children, husband, PTO, all of that, and she and her husband got addicted to heroin. And Mama Love. It's a memoir.
Oh, I'm gonna find that. I haven't read it.
And so someone in my community, she had a book club, and that book was being read in that book club. So she knew what I do, and she reached out to me and she said, "Can you give me some insight into some of this and why someone would lose their children over and want to continue to do heroin and go to prison and being all of that." And so, yes, there is still, and people are, I think, more open to trying to understand, but there is, it varies, I think, in each circle. But more books like that come out with showing that this is the life that happened, but she is now doing really well and succeed. She's written many books. And being able to help that. And I think, obviously, your podcast helps getting that word out. It's not... It is such a stigma and such a shame that people have been isolated and afraid to talk. And I started Resilient Butterfly, as we talked about, to show that people have been resilient, have come out of the darkness, and have been able to really flourish in their life. And to understand that there is more to life than constant chaos and struggle.
You know, one of the most courageous things that somebody can ever do is, is overcome addiction. It is so difficult. It is a brain disease. We talk about that a lot on this podcast. And, one of these days, instead of shame, we are going to start to celebrate the bravery and the courage of these people who have come out of the darkness and really worked on this and overcome addiction.
Yeah, for sure. I was talking to a man they're from Ireland. He lives in LA now, and he's going to come on the podcast, but I've never met him. I just talked with him last night. Someone referred me to him, and he said, my sobriety as a result of my sobriety is why I'm doing so well in my life. And what he's been able to establish. He's a film producer. And to celebrate, and he says, I used to never talk about my sobriety, but now I know bringing it out actually helps everyone, including myself.
It does.
Yeah. And there's there's a movement today of people saying that hearing my voice actually does matter.
Yeah.
So I want to go back to you a little bit. And just by the way, for our listeners, because our listeners obviously like podcasts. So when you talked about the Resilient Butterfly, that's your podcast.
Yes.
So that, and people can Google it right now.
And you will be coming on in April. So.
That's right. That's right. It's going to be great.
That.
Sure. And just so you know, Dr. Jerry Moe will be, I'm recording him on March 17th.
Wonderful. Oh, he's so great.
So I'm excited to have him come on, and it was really interesting. As I was talking to him, I was giving him dates, and he says, oh, St. Patty's Day, let's do that day. I can just honor my ancestors. like true enough, he always gets me laughing, he gets me crying, and so I'm excited for that too.
We're so lucky.
We are so lucky to work with him.
He's amazing.
It's funny. I tell people that I've known. Of course, I knew who Jerry Moe was. Many years ago, and because of Dr. Docekal and her work, we've gotten to actually work together for over a year to put in this program. You came and did some training as well with him, and this children's program, this 3-day children's program is just. And I get emails from Pam like, okay,
what can I do now?
What can I do? I want to help with it.
That.
How can I do more with it?
So have you shown Pam the photos of yourself getting tossed into the pool by the kids?
I will do that when we are done here. Yes, when Jerry's there, he gets tossed in the pool, and when I am,
Talk about that for a second. This is really very powerful. I love this.
It really is. So everything in our 3-day children's program, every single thing is intentional. Everything is on purpose. And one of the things is when you've got these children, 7 to 12, who've been impacted by addiction, there are certain things that are pretty common. And one is that when kids grow up in this, they learn real quick not to trust adults. They learn real quick that adults don't keep their word. And again, it's not because they're bad adults, but the kids don't understand that, right? We can talk about this. This is a function of the disease, but the kids just know mom promised to take me shopping and she didn't, and she was on the couch, or dad promised to do this. And so, one of the first things we do is we play with the kids a lot, and but we also have times where we intentionally give them the opportunity. We never say, trust me. Right. But we give them the opportunity to trust. And so in the very beginning of it, we're doing some exercises, throwing a ball, just having fun. I think you were in one of the groups probably where we threw the koosh ball, and it's just kids sitting around a circle with the adults. And then a promise is made. And the promise is, guys, this is, if we can get up to 50, or if we can get up to 40 or whatever it is, without dropping it, tomorrow, you can push John in the pool with all of his clothes on. Right? A promise that normally wouldn't be kept or wouldn't be, and they're dubious. And so no matter what, you better believe we make sure that they get to that 50, and you better believe that, and this last one was pretty cold. I'm just going to tell you, it was, but.
Not cool, cold.
Oh, it was cold. It was cold.
It was during that cold period.
It was during that cold period. Jerry got out of it, but one of the coolest things. Actually, I have to say this, if and you'll appreciate it. There was, they pushed me in the pool, and then we let them pile on and have fun.
Oh, wow.
And one of the other things that we see, and you've seen it a million times, is that a lot of times these kids have stopped being kids a long time ago, and they're little adults, because they have to. And there was a girl who'd come across the country, and she was perfectly well behaved, straight A, but she's also very kind of detached. And when the kids threw me in the pool and pushed me in the pool, and they're piling on, and I watched her just at the edge, kind of watching us, and she got closer and closer and closer. And then I saw this miracle second. She turned into an 11-year-old girl. She turned back into a kid and jumped in. So yeah, this program, and Pam you've been very supportive. And
I love the programs that you have established over this past year. Is incredible. The children's program, the Casa Flores program for pregnant women, amazing. I am so honored to know you and to work with you and continue these programs, because that's what it's about. It's not just a straightforward young adult or someone who's old that needs treatment. These children are part of it because they've been dragged into it, so to speak, just because they were born into a situation. And then, the Casa Flores, these women are not, they're not bad women.
That's right. That's right.
They're great women. And when you say that we should celebrate people who've gone through and recovered from addiction, is like these people, once you know somebody that has really changed their lives, the gratitude and the way of being is a shining person that people don't seem to get, because many times in the circles that I've been in my life, it's like you act a certain way all your life. And that's not because the same way with someone who has addiction, because they've been altered by the drugs. So they are a different person. And then when they recover, they're the greatest people on earth that I want to be around. I want to just join in with everyone.
We talk about these moms on Casa Flores. Make no mistake, they love their children.
That's right.
As much as we
love
our children.
Yes.
The drug, just as if I didn't have water, for a period of time, I would do anything to get water. Right. That's what a drug does to your brain. And, they love their children the way we do.
That's absolutely right.
They just don't know how to take care of them at that point until they can get healed, until there's help for them.
Yeah.
And so the going back even to how you do that, because it's funny in the children's program, we asked the kids once we're talking about it, how do people get better from addiction, right? And so one of the things that is so clear that you're really making clear, the hospitalization in any major illness is only the first step.
That's right.
And you've been, you're an Arise interventionist, you're a Love First. So that means that you've been trained both by, the Jays. We actually had Jeff and Deborah, and one of my
Judith
most, and Judith is one of my most beloved mentors. Love her. We're going to have Judith on too. We're just,
I can't even wait.
Dr. Landau's got a tough schedule, but we're going to get her.
Yeah, she's busy.
But the people that, you've been drawn to the, even these people there, they are people who look at whole systems. They look at whole families. And what drew you? Was it just, so your nursing is that initial background, and that's a very, when I think of nursing, and tell me if I'm wrong, when I think of nursing, I think of like, you're just dealing with this person right here, and your mindset has gone so much bigger.
So interesting. I didn't ever realize that this is where my brain was, but when I was working as a nurse in a specific area, and it started out as med surg and then intensive care and then a little bit in the newborn nursery and then dialysis. And
I didn't realize you were working in dialysis for a while.
Yeah, 5 years in dialysis.
That's amazing.
But each time, and dialysis was the longest period of time because I got close to the people, I think. And it was more, I felt like there was a period of time that I was actually with the same people and watching them. Some of them went off to get transplants and some of them didn't. But doing that, then I found case management, and I'm like, well, this is broader. I have the ability to change the trajectory of so many things because it is really being creative in what somebody needs and assessing specifically that person, that family, and what is it that they need. For instance, I may try to get her on my podcast too, but there's a video on my website. Her first name is Ada, who was one of my patients many years ago. She was hit by a beer truck when she was pregnant and severely injured, and she couldn't move her limbs. And they said, well, she's in bed. She was in bed rest. And I didn't get to her until after the baby was born and was referred by her attorney. Okay? Baby was okay.
Okay.
But she couldn't take care of the baby because of her injuries.
Sure.
And then, but nobody was looking beyond that. And I went in and her legs, I went to meet with her and her legs were moving. And I'm like, she's got to get to rehab. We got to get her rehab in order for the baby to have a mother, because everyone else was taking care of the baby, and then she was on her own in her bed. And so by doing that and convincing the insurance company to pay the aunt to take care of the baby while she went to rehab, they reunited, and she now has been walking for a number of years.
So for our listeners, this
is
classic Pam Feinberg. I mean, this is the work that you do.
You just
that
look into it differently.
Is incredible. Yeah, it is systemic.
Yeah.
Instead of just looking. So we, our team all loves you so much, and it is this type of approach that you take. I'm going to go back to the dialysis, and this makes so much sense now. Many times in older adult, we have patients who are in, we can take the most difficult patients at Hanley. So we end up with folks who are in end-stage liver disease, who, are having complications and having to leave campus and go to dialysis and things like that. And, so many times you're involved in those very, very high acuity patient cases.
And looking at potentially if they can get sober for long enough period of time, are they a candidate to get a transplant?
Yes.
And then following them through that transplant and after the transplant, because God forbid, which has happened, then they lose their transplant because they return to drinking. So they're obviously high risk, but having case management oversee and be with them and all along the way, so that they can be continually guided back into a healthier lifestyle for themselves.
That's right.
It's a beautiful work. I hate to say it.
Oh, shoot, are we at the end of our time
I hate
already?
to say it.
And I really enjoyed talking to both of you.
You too, and we're in our last minutes. And what we really like to do is let our guests have the last word, and thinking about, there's the people that listen to this are varied. There are professionals and non-professionals. There's people who are struggling with addiction and mental health and their family members, and then there's just people who listen to this who just find it interesting and like to learn about people. And we always like to let our guests just have their voice heard and think about who you would want to talk to and what you would want this audience to hear from you. What message would you want folks to hear from you today as the last word?
Well, I'm going to talk to the family because
I love that.
the family really has the ability to start the change. It's not up to them to change the person, but they can create an opportunity to get the person help.
Yeah.
And instead of watching them and being in their chaos themselves. There is help, there's hope, and families, if they pick up the phone and call either ourselves or someone else that does the same thing. We work across the country, so we can do an intervention and somewhere else. And it doesn't mean that we are going to pull somebody out of their house. I've been trained, as you say, in Love First and Judith Landau, Arise. This is a really soft way to work with the family, to get the family to understand they don't have to be afraid of this anymore. Right. That this has been I want to say, it's coming to me, a snake around their neck ready to pull. That they can let go that snake and let others help them and guide them into getting their loved one help, and then finding out more about what they can continue to do for themselves to get them really personally to do things for themselves to get better.
Yeah.
I love
It's so interesting, Pam. We have family members who call our admissions department all the time, wanting, looking for a resource, not knowing what to do, feeling frustrated because their, son is living on their couch in their basement, or, they think their mom or their dad maybe has dementia, but maybe it's just alcohol. And what do they do? And those questions that families have are so important, because you're right, there is help. Help's available.
Help is available. Yeah.
Pam, how would people find out more about you or reach you if they wanted to learn about your work?
Sure. Our website is feinbergcare.com, FEINBERG. And our number is 248-538-5425. That's a Michigan number, but as I said, we work all over the country. So we do have an office in Michigan and one here in South Florida, and then travel to wherever.
Your work is so excellent.
It's so fantastic. Thank you for taking the time to be here with us and share with us. Thank you, Dr. D.
Thank you, Dr. D.
And thank you, everybody who has joined in and watched or listened today. We are looking forward to seeing you next time on The Hanley Effect.
Bye, everyone.
Bye.
Thank you for joining us for The Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.